Okay. Hi, everyone. Welcome. Welcome to the Best Eldercare. So this is the third session. We started the year with a talk with Dr. Tanya Petrovic of Dementia Australia, where we really looked at how powerful a tool VR can be to help with kind of touching into and triggering empathy and awe. And we looked at the different areas in which VR can be used in elder care to support quality of training, raise awareness and for advocacy, and as a tool for elders themselves to really get pleasure, a moment of awe in their day. The second session was with Florence Mathieu of INA in France, and we talked about human-centered design, so co-creation, where you're looking to redesign a nursing home and the real value of involving residents, family, staff in the design process, so that the outcome you get in terms of the nursing home and the service delivery is vastly improved because of the process you've taken. This month, I have the privilege of talking with Wang Long Li of Tinybots here in the Netherlands. And we'll be discussing social robotics. So these are care robots that are used in home care settings as a tool for social care to help people stay competent in their actions, autonomous, and socially connected. Essentially, these are the things that I'd very much like to focus on. And Wang, after finishing his PhD, founded Tinybots in 2015. Very much, I feel, guided by these insights. And the company, from what I can see, has been wonderful and doing really well. I've been just following it since the beginning. And there's something really powerful in the story as he tells it. So rather than me labor on, I'm going to ask Wang to help us understand how a social robot helps somebody to maximize their quality of life and live longer independently at home. Is that a fair question to ask?
Thank you, Raza. Thank you for the kind introduction. I started Tinybots based on the experience and interviews and the privilege that I had to follow quite a few elderly people with dementia who were open to show their lives, so I could stay with them, observe, and like a shadow, I could follow them to understand the real needs. And during my research, I started with the with the old paradigm of looking at robot as a tool that can automate something, just making some tasks easier by taking over those tasks. But what I discovered was that that's not actually what this user group really needed. Because I still remember one person. I was an older gentleman was had difficulties with his movement. Half of his body was paralyzed, but he was doing his utmost best to actually take out the dishes from the dishwasher. And I saw how much time it took him and also how much he struggled with all the movement. So I asked him, or I tried to actually convince him what a robot or robotic technology could mean in this moment. Maybe pitch an idea to see if that would resonate with his needs. So I told him about maybe the possibility of a robot that could do this task for him, and he said, "No, young man, you're totally missing the point. You don't understand actually. But it's not about the task; it's about the meaning behind it for him to doing it." Because he told me he's receiving so much care from his partner, and he just wants to also do something back with the things that's still in the possibility for him to just taking care at home, doing some household chores. And for him, it means a lot to feel like he's not only a person receiving care, but he's also still a partner, and can still be a partner for his wife. And that was actually one of the moments that really brought me into different, looking differently at this technology. And then I asked him, so how could we use this potential of technology, the robotic technology, in your benefit? And then he mentioned, well, I want to do, I need something that can remind me or give me structure, because that's what this dementia is making difficult for him. But he wants to do it by himself, not just taking it over, but he wants to be supported as best as possible and enabling his autonomy. So that was one of the, I think, key moment that gave me the insight. Okay, so we should really look different to what kind of meaning we should give to this kind of technology. And then and that was also the starting point where we actually really started with a blank canvas again, because we bought a lot of existing robots and testing them, but that was more from a technological perspective. And now we are going to focus on more the psychological and the human aspect, like how can we make this technology meaningful for this group? And we started co-creating with them and building prototypes, and then we came with the idea of having a little robot giving verbal guidance and make the person with dementia feel like they're still in control. They can decide whether they will do, but just they will give, the robot will give them some structure by reminding them on something, or giving them options, asking them a question, or give suggestions for certain things to do. And that helps them to actually still have a good, or at least feel they have a good autonomy in life. And the robot will increase, of course, in how much support we'll give over time, but just enough for the person to make the right decision and do the task. That's what we are trying to aim with the end goal of supporting the human autonomy of the person with dementia.
Yeah, thank you. That's really clear, and yeah, it's a very elegant example. Thank you. But so essentially, it's this point that you made previously with me, which was that if you could help people in their behavior, with their behavior and their habits early on, then that has can really affect how a disease or a condition progresses and the impact it has. Can you give kind of a concrete example of, the different interventions that I see behind you, there's Tessa, might be giving that would lead to different health outcomes or different trajectories, I guess?
Okay. So I'll give you some real life examples that we encountered. There was a lady who used to be very strong in life and doing everything by themselves, but that also complicated the level of acceptance of others giving care or giving help, especially from the daughter. So what we saw was that lady had to take medicine, and then the daughter is trying to remind them, but every time when the daughter says it, she will react as, of course I will do it, but I will do it later. I don't feel like doing now. But then 5 minutes later, she already forgot. And actually, that was already the 5th time that the daughter is reminding her. And at the 6th time, you can see that, or we observe that the daughter is also losing patience, and then and she feels like the daughter is becoming angry, but she doesn't. The person with dementia is not aware that it's already the 6th time that she's being reminded to take medicine. So when we use Tessa to remind about medicine, somehow the lady reacted positively from the first trial. So when Tessa says, okay, Madam, it's time for your medicine. You can find it in the kitchen. She reacts as, oh, I already know, but then she stands up and it goes to the kitchen to take in the medicine. And the interesting thing there, when we try to investigate it, and also with many more participants in our study, was that they said, I don't feel any judgment from the robot because they don't know that I forgot about it, but they know that if the daughter or somebody else is asking, somehow they don't want to show that they forgot, but they don't feel this the judgment from the robot, so they don't need to cover up. So, and that's also the positive effect of how we can stimulate the structure, reminding people eating on time, motivating them to eat on time. But also, we encountered many people who have loving daughters and very good caregivers, but they cannot be there 24/7. And of course, from the disease, dementia, it's something that doesn't switch off. It's all the time there, which means they actually need 24/7 structure. So especially in the summertime, we encountered that there are many elderly who forgot to drink, and because of the heat, they are dehydrated, and there's a lot of negative effect on their well-being, and that's something that actually TESA prevented. So we apply TESA now mainly via the care home, and we're looking into the care moments to help that. But often, and we see that as a side effect, the person also feels less lonely. In the Netherlands, most of the user group are living alone at home, and they also feel like there's a social presence in home with this social little robot. TESA is not so talkative, but it does by asking questions and stimulating activities. They also feel less lonely in that sense, and I think that has also a very positive effect.
Okay, so in essence, you're saying the way that you're affecting behavior is by helping people to keep a healthy structure in their life, act on triggers that help them to do things that are good for them. And the other piece that you're also showing is that there's also a great outcome with the person who's a caregiver, in that they're not getting frustrated, they're not getting impatient, and they're also able to take a break and know that there's something else that they can lean on to help their loved one.
Yeah, indeed. We received a message after a month from a man who mentioned that that week was the first time in 5 years that he could actually go home to sleep with his in the same bed as his girlfriend, because he had to stay at his mom's place because he had to be there all the time. He felt like he had to be there all the time. Wow. So that's also, I mean, that's also impactful from the caretaker's side. And you mentioned the trigger, indeed, it's an intuitive trigger that we actually that we use via verbal guidance instead of a reminder or maybe a sound and some noise to remind somebody. I mean, there's a lot of also product out there that is very effective and reminding people with for medicine by giving a certain signal, but at some stage, by using verbal guidance is very intuitive for this person, and you can actually adapt the verbal communication in a way that the person understands. Depending on different stage, in the early stage, just a simple reminder saying it's time for your medicine is enough. But at some stage, more instructions, maybe 5 steps, is needed to guide the person to still take the medicine, but also to make coffee or to make the dinner, or reminding them there's somebody coming over, a family member. And by preparing the person for those moments or for those appointments on time, it also lowers the stress level, because the person with dementia often also feels like they might forget something, and that gives a lot of stress. And this stress actually also limits or reduces the cognitive capacity.
Yeah,
I also feel that when I'm very stressed, I cannot think very clearly about
absolutely.
many things. So that's
Absolutely.
also happening, and so that's also limiting actually what they actually still can do. And by reducing the stress, by giving the structure, reminding them on time, 15 minutes before somebody's coming over, saying who the person is, what the name is, and what actually appointment is about. They can prepare a drink and the tea, and then they feel like very more comfortable. And I mean that's that gives them more the feeling of still having a grip on life.
Yeah, yeah. Thank you. That's really, I really love that you make it so human and it's not just functional, like you say, this robots and efficiency story. You know, really important, I think. So I just want to take a moment to, because there'll be people who will be listening who don't know that much about the Dutch market, and I think that's going to be relevant to our story. So the Netherlands is a very small country. I think if you drive 2 hours in any direction, you've gone into another country. Very well organized, I would say, compared to other countries I've been to. Also rich. I think that's also important. And by rich, I mean, you know, like less than 1% of the population of the world, but about 2% GDP. So really quite rich, you know, almost 2% of global GDP, you know, so really up there. Densely populated. I think that's also relevant because everybody's nearby. These things add up. Compulsory health insurance and aging population, densely populated. So effectively, there's a demand to make sure that you do it well in a rich country that's densely populated and aging and well-funded. I put it in those terms. So actually, some of the changes that you are taking place in other countries which are much larger and logistically much more complex just because of scale, they've happened here already. So actually, maybe a little bit before or around the time that Tinybots founded, there was actually a policy change. You know, there was funding shift to helping people to live longer at home independently and care home, so social care, thuiszorg, you know, care at home. And the care home and nursing home really got the population there got smaller in that you need now a much later or advanced indication in terms of the onset of impairments before you go into homes. So there has been then demand in quite a structured way for solutions that help in home care settings. And I think Tinybots and you, Wang, especially just with your insight and approach to this challenge, as it were, came together very well at a great time. And what I want to ask you to explain is, in a moment, is just when somebody, you're working with social care organizations. So I want to understand when, after somebody has a diagnosis, they typically might get TESA. Like you've already explained the evolution of how TESA is used, or a social care robot is used. If there are any examples of people using through home care and when they move into nursing homes, I'd be very interested to learn about that flow. And maybe I stop there because with the request, as it were. And I think it's worth mentioning that there's been a change. So for 7 years, you collected data to demonstrate that I think not only did you save caregiver time, as in, you know, so the cost burden on social care organizations, but also that you helped with structure and so on. So you preempted issues arising, basically, with all the things that Tessa does. And having collected that information, now you're at this position where health insurance now covers Tessa, right? So now you're going to go into another phase, right? You've proven your case. Can you maybe tell that story? When people start using Tessa in the indication, how you approach, onboarding someone, for want of a better term, as a user, how that progresses, and whether there's anybody in the nursing, or there are people in nursing homes who are also using Tessa.
Okay.
Yeah.
Yes. Yeah. So let me start with distinguish maybe some of the healthcare financing in the Netherlands. The social care, or more on the very early stage, and focus more on wellness, they call the BMO. So it's more financed by a municipality. And there's the health insurance, and that's the long-term care, the WLZ. And we actually focus on the middle. And the reason is that part gives the biggest opportunity to actually impact on the point where also the urgency is highest. So it's more strategic decision to focus there. We tried with all three, but we found out that in the very early stage, although the impact on the lifetime is bigger, the urgency, the feeling for and acceptance of this user group and the healthcare sector was very low, because there are a lot of other ways to take care, and the person with dementia is not really accepting that they have this disease yet. So that's what's the difficulty. So that's why we focus in the middle part from the health insurance, where actually if somebody has an indication that it really needs professional care, and also there the costs are really rising very fast, and also not enough healthcare professionals to take care of the rising numbers of patients. So that was the opportunity that we want to start, and then grow from there to the other areas. But the first thing that we needed to solve was somehow get our product reimbursed, because in the Netherlands, the culture, I think the healthcare system is pretty well organized, but because of that past, people are expecting that a lot of things related to health should be organized for them. So there's not much tendency to pay by themselves, especially for this home care, more related to the professional care. And they have a point, because they're used to the alternative. The current alternative is that somebody, a healthcare professional, will come to their home and take care of them. If they are going to choose for a product that actually saves time for the healthcare organization and save money for the health insurance, why would you as a consumer pay for it? So that was the discussion that we were in. And so we took the path of least resistance and finding a way to somehow grow faster than convincing every consumer. That was to target the health insurance companies. So how can we make a business case that they are willing to reimburse? That would remove one of the major barriers, because the health home care organizations in the Netherlands, they are all they are organized in such a way that they receive finance from health insurance and from the government. So the patient themselves doesn't pay much for it. The way we did it was to start really small. We discovered that many of these health care providers has some innovation budget, and we made a proposition of very small pilot to first gather data within in practice. So in 2017, we built 100 of these robots Tessa. That was one of the first prototypes, and we actually convinced 3 healthcare providers to give this, and they finance it. They pay for all the 100 to test it for 1 year at 100 families, and we followed in that 1 year, and we promised we will solve every issue that we encountered as fast as possible. So we were testing, but also learning and immediately also developing actually the solution. But they had a big say. The healthcare providers could actually also give their requirements to see how it fits in their care procedure. And I think in 2018, the pilot ended, and we were so we should take all the product back. And at that moment, the healthcare providers were confronted with the situation that the families doesn't want to give the product back. And even if they had to pay by themselves, they would do it. So that was actually the proof point that was also very convincing for the healthcare providers. Okay, so we have something here at hand, and let's now think about the business model. How can we actually make this work? And we look at to make the long story short, the way we found was to fit in as much as possible in the current system, because changing the whole system would take a lot of time, a lot of effort, and a lot of parties, a lot of stakeholders we have to take. So we looked into the home care procedures in which the healthcare insurance were already financing for the hours of of a person going there taking the care. We analyzed those care moments and then asked the healthcare professional, can you show us, or can we come along to see how you perform this? And we discovered that many of those care moments is done verbally, but they were not always aware of it. And that's also what they want to do, to increase the self-reliance by just giving verbal guidance. But at that time it was given by the healthcare professional. So we try to replace those moments with our product and see how that would work. And then we were measuring with a very simple research method called goal attainment scaling method. There was a method we choose because it's a very elegant method that can adapt to individual situations, because every patient is different and based on not only the disease, but also personal needs, wishes, but also the living conditions. There's a lot of influence on what kind of effect and how effective it is. So the method allows us to measure things that it's adapted to that situation, but then we could translate it into a more generalizable quantitative value, and then we can actually say something about impact overall. So we use that, and then we found out how much it would help with people who has malnutrition, people who doesn't forget the medicine, people with sleeping problem with sleeping habits. All those things we measured it with that method, and then calculated back into how much time it actually really would save for the healthcare provider, but more importantly, how much it would save eventually for the health insurance, because they were paying at the end. And we did it with I think 9 organizations over a course of 1.5 years. That includes about 170 patients, I think. And we found that every week, on average, we could save about 1.5 hours of labor by applying this verbal guidance via our little robot. Just to give you some background, so 1.5 hours per week doesn't sound much, but in general, on average, a person receives 4 or 5 hours of care, I think, per week. So that's that. So that's about 30%, and in some cases it even saves 4 hours. So it's almost 100%. If we implement it really well. So that's the another topic, the implementation part. So we presented this, and then we had. There's also some luck factor, of course. The government in 2019, I think, announced that they are also changing some of the structure. Normally, they would only finance hours labor, but the government, NZA, the Dutch health authority, also created a new, how do you say that? A new code that allows you health insurances to cover the cost of technology. And for every patient per month, 6 hours could be covered up, 6 hours in terms of the cost of a nursing labor cost. And our product only costs about 1.5 hour. So that's and 1.5 hour per month if we calculate in those terms, but they can save up to 6 hours a month. So that was a very positive business case, and that helps the health insurance to actually consider this. And I think 3 out of the largest health insurance companies are reimbursing this now, and that takes away the biggest barrier actually to scale up. And now we are, just to give you a sense, we're now working with 150 home care organizations, or more than 150, and there's about 2,000 of this little robot at people's home. Some of them are already living together for more than 3 years, so very long term. And that's also what we find interesting. We are not actually building this robot as just as experiment or for short-term care. It's really for the long-term care, considering the length of this disease that can take up to 20 years. I think on average it's 8 years.
Yeah, thank you. Thank you. That was, you gave much more full explanation than I was expecting, so thank you. It's really good. It's also, I think, really helpful because if people listen to your explanation, they'll really get ideas for how they could do things as well. And I think that sharing is very helpful. You know, it's very difficult to work out sometimes how to get to the next step that you need to get to you know, keep growing and have the energy, and you know, that's important. Yeah. I want just, well, you've touched really on lots of things, and I wanted to just bring some of those into neat.
Sure.
So you talked at the beginning about something that a robot can do that humans can't, and you also mentioned like other ways of getting reminders. So now I think, you know, if you could give a summary answer on what can a social care robot do differently than the same thing if it was done with a tablet or Alexa, you know, or a person who's the caregiver. So you've touched on some of this thing, but maybe nice to just bring it together and give it.
Okay, let me start with let's say a caregiver and a robot, especially social robot, as how we look at this this category. I think they are not competing. They were complementary. I think the strength of this product, how it could complement, is be available all the time and bring messages or reminders without any judgment. But the downside of this of having this robot, I mean the limits maybe for this kind of this category of product, is that we shouldn't try to too much or emphasize too much on the relationship building, because I also see a lot of robots being built, social robots being built, that's really trying to engage in a very deep relationship to prevent the feeling of loneliness or to solve loneliness sometimes. We don't really think that that's possible, because the human relationship is way more complicated, and because it needs two-way, let's say, reciprocity is needed to build this relationship. And a robot, by definition, doesn't need much. Actually, doesn't need anything except maybe to some electricity to function. So that would be artificial that you would introduce. I think what we would like to see is that the relationship is being built with the caretaker, with the care professional, that can give that attention and the warm human touch in there. And the robot can mediate certain difficult messages.
That's yeah, indeed. So I'm pleased you're really open and frank about this, because indeed I see too much emphasis on as if a robot is going to have empathy, you know, and then compassion, and then you know, you're going to have a relationship, and you know, that's, you know, yeah, good.
Yeah,
thank you. Yeah.
And then your second part, and I'll be more brief on that part.
Sure.
Give you an answer. Is the tablet. I think functionally, tablet or Alexa, functionally they can do the same thing. But I think in comparison with a tablet, the biggest difference with a social robot is a robot has a social presence in there, which means when I receive a reminder or something on my smartphone or tablet, I can just swipe it away and ignore it very easily. I don't have much emotional attachment to it. But when we see with the users of the social robot, they find it more difficult to ignore, because they feel the emotional. They still have some emotional bond with a social robot, and because of the social presence, they don't want to ignore. They feel like they feel guilty that they have ignored it. So then they are following up the question or the request better if the social robot would give the reminder. That's the biggest difference that we see. And in comparison with Alexa, I think it's just more the system architecture behind it, and for what purpose it is built. I mean, pure technology-wise, it's pretty much the same. However, we adapt every software for this user group. So we make the communication easy, make it feel intuitive. Instead of learning the different phrases you need to communicate with the product, we say the product learns how you talk, so they can set up how they would ask certain things, ask about the time. And also when the product initiates, so in our case, most of the interaction are initiated by the product, by Tessa. But when Tessa asks something, she prefers to ask in a closed question. And the reason is we know that with people with dementia, if you ask open question, especially in the more later stage, it can be stressful, because they're looking for the right words, and they're trying to find the right answer. While if you ask it in a closed question, give options, then it's easier for them to answer which one is actually the one that really resonates with them, or which answer is really the true answer for them. So we adapt this kind of communication, and then we use speech system that learns how a person talks, instead of the person needs to learn how they communicate with it.
Perfect. Thank you. That's really clear. Great. Yeah. So I've just two topics that I want to touch on with you in the time that we have. The first is just, I think there must be, you've already introduced a couple of stories, you know, anecdotal about people's experiences, but just the unexpected things that you've learned from implementations, you know, how to go about it. I mean, when in the first session, with Tanya, she was explaining, you know, it's really important, that first moment of how you put on the headset and introduce something for VR for an elder, you know. There must be just some things you've learned about how, you know, even Tessa agnostic, other social robots could be introduced. And you think, okay, look, this is just helpful to people to know that this is how you should do it, right?
Yes.
Yeah.
Yes. Okay. I'm going to first focus on how to introduce it to the typical user group. We actually have two types of users. We have actually the healthcare professionals who needs to configure certain things, and we have the elderly with dementia.
Yeah.
So I'm going to talk about it later.
That's the piece that's interesting.
Yeah.
Yeah.
Yeah. Okay. So yeah, what we discovered, and I think it touches upon the idea of really human-centered design, and also designing the services with that mindset, is to understand how that person is experiencing the world and try to understand the life of the person. So let me address this with a small story. There was a man who was who had dementia, who keeps on walking away. And that wasn't a problem for the caretakers. And at some point, the caretakers decided to use some technology. So they started with sensors to analyze where the person is. And the person still walks away, but then the alarm goes off. The caretakers are always too late there. So then they go a step further and they start to put a lock on the door, and that can only open at certain time. Still, the behavior happened, and then at some point they got in contact with Tinybot, and I was allowed to get involved in this case and think along. And the interesting thing is that they had an outside view all the time. Like, okay, so we see a behavior that we don't like or we think is wrong, so let's do something about this behavior. Try to restrain it, try to get control, and try to limit the freedom. And our approach in Tinybot is to look from inside out, understanding the person first. So we try to communicate with them and try to understand. So why does this behavior start? Maybe the behavior is not wrong. The behavior is just something as a consequence of some beliefs or some things that the person experienced. So we want to understand, so where does it come from? Why does the person, what's the explanation from the person itself? And then this man it was difficult to communicate, but eventually he made clear that he wasn't walking away or trying to run away. He was actually looking for his wife. And then we analyzed the moment when he goes outdoor is when his wife is doing groceries, because he's worried, he doesn't see his wife. He's worried that in his experience, his wife is already gone for hours. And that's why he's looking for her, and he goes outside. So once we understood this, we said, okay, let's find a totally different solution that fits in his experience. And maybe we just need to remind that the wife is coming back in a half an hour. So we tried this. We didn't try to put a tester there. We just want to first understand this, whether this solution would work. So we put a small note written by his wife at the door saying, I'll be back in 30 minutes and please have a cup of coffee. And I already made some soup, you can warm it up. And then this stops. All the other things wasn't needed, or restraining or locking the door. So that's the approach that we have. So every time when we go introduce the product, we don't start with, okay, so you have this problem, we have a solution. And we try to actually really just sit down and let the person tell his story. We try to stimulate and really have a conversation, and then discover from their experience an issue that where Tessa might be a solution to help them. And that could be something like, yeah, I often forget to feed my cat, or no, we start with those things, or last weekend, the person with dementia, if they open up and telling how their life are, and then life is, and what kind of things they enjoy, and then at some point they feel trusted, and they will mention, okay, so actually last weekend I find it very annoying that the taxi was already here, and I had to hurry, and I forgot my wallet, and I know, and that's the moment, the opportunity to introduce. We'll say, okay, so what if if you were reminded 15 minutes before, would that help you? Yeah, that would be great. So, okay, so, and would it be helpful if 15 minutes before, we also remind you to put your wallet already there so you don't forget? Okay, and then they start to accept, because now they feel it's a solution for their problems, not for the care givers.
Yeah.
And of course, when we introduce it, we also will put some of this, reminding the medicine, but but taking in the medicine might not be the first thing that the user is experiencing as a problem. So we often start with this their experience, and also one of the things that we discovered that's very important for acceptance is the end of the conversation. We know that in health, there's a lot of time restraint for the healthcare professional. So they have to go fast, and maybe they only have 10 minutes to explain how this works, and then they have to go. But this feeling of being rushed is not so great for increasing the acceptance of the for the person with dementia for this kind of products. So we often we actually also designed a new position in our company. We call it the Tessa coach, and that person is trained to help actually introducing the product, and that person just goes there, listen really well to the story, discover this opportunity, but also takes all the time. Maybe sometimes we're there for an hour. Sometimes within 15 minutes is already very clear how it could be helpful, and the person feels trusted. And then, but one key moment is the end. When we leave, the person should feel everything's still okay, and they feel very positive about the conversation. They might forget the conversation, but the feeling is still there. The feeling will stay longer. So when they have a positive end at the conversation, and they look back at Tessa, the positive feeling is associated with Tessa, instead of the rushed feeling of, okay, something was forced on me. So we put great attention to that moment. How do we leave the house of a person with dementia? That person should feel like that he had a good time when talking with us.
Perfect. Thank you. You again, I love the answer. That's a really perfect explanation. I think, you know, how you do something is all important. You know, take a user-centered approach. That's you know,
yeah, and maybe some small detail things. So we also designed certain small props, and like sending a postcard before we go there, introducing Tessa as an individual, like, oh, I'm going to stay over for a couple of days, just to make it feel like, okay, it's about them, and it should be approached as more like a normal day, instead of there's some procedure and protocols, and now we are going to experiment.
Great. Yeah, perfect. Thank you. Now, last question. Yeah.
Okay.
When we spoke last time, we talked about, it's great that this insurance moment is happening, because, you know, you've proven that Tessa works, and you really know how, as you just explained really well, how to put it into practice and find a user-centered approach every time as much as possible, right? Because this health insurance, you can scale up. You have a bunch of problems, of course, or challenges, hurdles in scaling up, but okay, that's happening. Which means you can start to implement your vision that's, I know, been kind of cooking for a long time. I know that, you know, you've designed Tessa as an open, interoperable system that, you know, you can see a whole myriad of connections with other devices then, you know, smart home. And this can be, of course, again, a next level, transformative in how helpful social robotics can be, social tools can be, other measurement tools can be connected together to help somebody to live longer, fulfilling, meaningful, independent life at home. I mean, how can you tell me about that?
Sure. Thank you for the question. This is actually this is a robot we call Tessa, but that's actually not the thing that we are really focus on as our core product as Tinybots. I think from the start we had this vision of creating a system that's ubiquitous around the user, that can help the user whenever the person needs it. So of course this little robot is cannot move, and so it's limited in which touch point it has with the user. But we had to design something very simple just to start initiating and collecting valuable user data to understand the behavior. And so our whole system is actually in the cloud, and it's connected to every Tesla via Wi-Fi. So it's collecting data from all the users. And just to clarify, we don't process any personal data, because we also developed a algorithm that filters out all the personal data. We don't know any names, ages, addresses. That's being all filtered out. But what we're interested in is the changes of which kind of verbal guidance a person needs. So, and our vision is by understanding the changes, because of the progressive nature of this disease, we could optimize the way our system should communicate with the user group. And we are specializing on that. And in line of creating a system that's ubiquitous, we need to make our system in a way that could connect with other devices that you mentioned. Could be a smartphone, could be a smartwatch, could also be a Bluetooth earpiece. And then the person can also go outside and also have this verbal guidance when it's needed. And it also, and in our vision, it also unlocks the data sharing if we have it in the cloud. And that's also one of the projects that we are already starting, building with 2 other healthcare technologies, who has data about the medicine, who has data about the family members. So we understand by using those data, we can adapt and also see which other activities we could introduce that's possible for this person by involving maybe a family member in it, or by so one of the other product that we are integrating with is a very specialized reminder of medicine. And if the person doesn't take the medicine, alarm goes to the healthcare professional directly. And it's a great product. But the thing is, the alarm is not always needed. Because sometimes somebody doesn't take the medicine because the person has maybe visitors, and they're like, okay, I will take it later. So we are using this data and validation to understand those situations. So Tessa could get a signal that the medicine hasn't been taken, ask the person, so should I remind you later, or what's going on? And based on the answer, we could actually adapt the system and adapt the alarm. I'm straining it, but so let's get back to the point of why we want to adapt the communication. So one element is the progressive nature of this disease. The other element is that the current system requires a family member or a healthcare professional to set up, to write scripts. But unfortunately, not everybody has a very involved family member or a caretaker that knows the person well enough. So to make this product, so make our system also effective for them, we want to apply artificial intelligence to go through our database, try out certain way of communicating, validating whether that would work, validating via an integrated sensor system to see if the behavior is taking place. If not, we try a different kind of script to find out the elements, how we can optimally communicate with this person. And once we found that, then we can actually apply it to all the other scripts. And so at this, up to today, we have collected about 25,000 scripts, and those are all entered by thousands and thousands of healthcare professionals and family members. So those are validated, that is being really used. And now we are at the stage of digging through the data and building the algorithm to optimize it for future users.
So just, I think I understood, but just make sure. Yeah, right. So essentially you're saying right now, for example, Tessa can't be everywhere. So yes. If, for example, you had other tools that you were connected to, then you would be able to, for example, measure sleep quality, measure, you know, other elements, things that are happening in the house, showering, etc., etc. And you also have a scenario where there isn't always somebody who's going to be there to help configure Tessa to begin with. So you're having those two things take place now. You're having, because of you've got a lot of data, you're able to try something out and see if it works without the configuration, you know, trial and error, but educated trial and error, as it were. And being more connected over time, of course, increasingly, with other devices in the home, you're also able to then, of course, measure whether that trial and error has actually worked out. That's really, and then basically you're creating a much more autonomous system. That's an holistic picture, which will give you more data.
Indeed, and I think for markets where there's also where the healthcare system are more used to e-health, they often has a electronic patient file system, and then we use that actually as the first input of what kind of care needs the person has, and then we optimize the way of communicating and giving the verbal guidance via our system. And it could be connected to any device, but also other robots. So we are specializing on the verbal guidance and deciding which kind of script would work for the person. And we, in our vision, we prefer to collaborate with others to do other things, more the physical task, because at some point, the person is also physically will experience impairments, and then just verbal guidance is not enough, and then we try to complement it with other technology.
Thank you. Perfect. Really, you painted a picture from beginning to end. It's great. Thank you. I'm going to wrap up because I know we basically run out of time. Again, thank you. You made something that can be quite cold and clinical, functional, very human, personal, and there are elements in here that I think you've been really open about how you've done things, and that's helpful to other people who are also wanting to do similar things in other parts of the world. And I think that sharing, that openness is helpful. Because we're not always competing. We might feel we are, but we're not. You know,
now we should collaborate on this.
That's right. We should learn
challenge
and grow together. Yeah, absolutely. Yeah. So thank you for that. Thank you so much.
Thank you, Reza, for the conversation.
Sure.
The opportunity to share the story.
That's my pleasure. My real pleasure. Just before I wrap up, next month, so 27th of April, really a different topic. I'm going to be talking with Dr. Gary Irwin Kenyon about whether Tai Chi should become a standard tool used in dementia care. There's a lot of evidence for how Tai Chi can help general health, especially as you're aging, with a whole lot of conditions from arthritis through, sleep, and I mean, there's a long list. I don't need to go into it now. But we'll focus very much on dementia and the evolution of dementia care and how Tai Chi can be a really helpful habit to nourish. Okay, I very much hope that you're able to join us, everybody. Okay, thanks so much. Thanks again, Wang, and stay well.
Thank you.
Good luck with what you're doing. Yeah. Bye-bye.
Bye-bye.
Bye-bye.